Welcome to Scienceado. In this video, we are going to see about what are COVID new variants, origin of these variants, what are the symptoms, how frequently are these spreading, will vaccines and treatments work against them? New COVID variants BQ.1 and BQ.1.1 have arrived. Most cases of COVID-19 are now caused by the BQ.1 and BQ.1.1 variants, which are versions of Omicron. About 63% of COVID-19 cases in the U.S. are now caused by variants BQ.1 or BQ.1.1, according to the latest estimate by the U.S. Centers for Disease Control and Prevention. Both are subvariants of Omicron, which has had a tight grip on the world since last winter. BA.5, the highly contagious Omicron subvariant that caused a lot of reinfections or first infections in people who hadn't had COVID-19 this summer and fall, is fading and now only responsible for about 14% of cases. Viruses like COVID-19 mutate. We've learned to accept this by now. But not all mutations are created equal, which is why scientists are watching to see how the plethora of Omicron forms will affect people this winter, when there are also a high number of influenza and RSV cases circulating. Cases of COVID-19 have simmered at much lower levels than this time last year. Deaths reported from COVID-19 are also down considerably, though somewhere between 250 and 270 people per day are still dying from COVID-19. The stability we had this fall, however, may be coming to an end. According to the New York Times COVID-19 data tracker, hospitalizations are rising again in nearly all states. Like all new versions of COVID-19, we'll need more time to see how BQ.1 and BQ.1.1 play out in the U.S., especially after the holidays, with the travel and gatherings that we may expect to fuel the fire of contagious illness like COVID-19 and influenza. Both have also reduced the effectiveness of our monoclonal antibody treatments, which have been reserved for immunocompromised patients. Here's what we know about the latest versions of Omicron. What are BQ.1 and BQ.1.1? BQ.1 and BQ.1.1 are newer versions of the Omicron variant, a variant of concern, that first emerged last winter and caused a massive wave of COVID-19 infections. According to the World Health Organization, BQ.1 is specifically descended from BA.5 and carries a few extra mutations. BQ.1.1 carries an additional key mutation, making it one to keep an extra close eye on. Omicron, Delta, Alpha and earlier strains of COVID-19 were given their own Greek alphabet label and separate distinction as variants of concern because they proved troublesome enough to scientists in the way they evaded vaccine immunity, caused more severe illness or created more serious problems. By contrast, although BA.5 was extremely contagious and caused more reinfections in people who already had COVID-19, it didn't necessitate a big enough change in our public health response to get its own name from the WHO, according to the classification logic. Before we dive into the next thing, please subscribe to our channel and smash the bell button to get notifications on the new video release. ECDC predicts BQ.1, BQ.1.1 variants to become dominant by the beginning of December 2022. The European Centre for Disease Prevention and Control, ECDC, has predicted that by mid-November to the beginning of December 2022, BQ.1 and BQ.1.1 variants might account for more than 50% of the COVID cases. The prediction, which is based on modeling estimates, also says that by 2023 these variants could account for more than 80% of the cases. Origin of these variants. Both BQ.1 and BQ.1.1 are the variants of BA.5, which is an Omicron subvariant. On October 27, the World Health Organization, WHO, released a statement on the BQ.1. BQ.1 is a sublineage of BA.5, which carries spike mutations in some key antigenic sites, including K444T and N460K. It said and warned that it is showing a significant growth advantage over other circulating Omicron sub-lineages in many settings, including Europe and the US, and therefore warrants close monitoring. Higher infection risk is a possibility. Citing the additional mutations of the virus, the WHO says, this might have conferred an immune escape advantage over other circulating Omicron sublineages, and therefore a higher reinfection risk is a possibility that needs further investigation. On the infection risk associated with these variants, though both the variants have relative number of mutations, BQ.1 is more concerning and could pose a threat to our immune system's response. Will it lead to a surge in COVID hospitalizations? While the number of BQ.1 and BQ.1.1 COVID cases in India is less and much about hospitalization cannot be derived from it, in the US where the number of cases are high, less number of hospitalized cases are seen. What is encouraging is that New York State, the highest BQ.1.1% in the U.S., still shows no sign of increased COVID hospitalizations. Same for the U.S. overall. Milder symptoms are expected. Until now, the top COVID symptoms have been fever, headache, sore throat, runny nose and fatigue. Ever since the Omicron variant has been in circulation, it is seen that mild symptoms are seen in COVID patients. Every time a new subvariant of the Omicron emerges, there is a worrying concern around the severity of the symptoms. However, so far there is no evidence associating severity with BQ.1-led infections. Will vaccines and treatments work against them? Monoclonal antibody treatments, including Evusheld for immunocompromised patients, will likely no longer work against BQ.1 or BQ.1.1, according to information from the National Institutes of Health. Bebtelovimab also doesn't work against the now dominant subvariants of COVID-19, and the FDA revoked its authorization in the US on November 30. Other monoclonal antibody treatments were removed from the U.S. market earlier in the pandemic as the virus rendered them ineffective. There's no indication that Paxlovid, an antiviral for higher-risk patients in the first few days of their illness, won't work against the newer forms of Omicron. How much protection will be given against BQ.1 and BQ.1.1 from the new, updated boosters, which are tweaked formulas meant to target the BA.5 subvariant in addition to the original form of the virus? Moderna said earlier this month that a small analysis showed a robust antibody response against BQ.1.1. Though there was about a 5-fold drop in antibody titers compared to BA.4, BA.5, Moderna said. Some early research does suggest that BQ.1.1 is neutralized more effectively by the bivalent boosters compared to the original vaccines. While there's still some gray area over how much better the new boosters are at protecting people compared to the original formulas, and some scientists have called for a new approach to vaccines in general. Boosters and vaccines in general have protected against severe disease and death throughout the pandemic and across mutations of the virus. In August, unvaccinated adults were over 5 times more likely to die from COVID-19 compared to adults aged 18 and up who were up to date on their shots. Hit the like button if you like this video and share your ideas in the comment section. And of course do subscribe.